in Canada, kidney disease affects millions of Canadians, and we've heard about the impact of diabetes. Kidney disease itself also affects millions of Canadians. About 4 million Canadians live with kidney disease of various levels of severity. And this is very costly to the healthcare system. About $40 billion per year goes toward the care of chronic kidney disease. And about 50,000 patients in Canada are being treated for kidney failure, and about 60% of those with kidney failure are on dialysis. Importantly, about 1 in 4 patients who start dialysis have never seen a nephrologist. And this brings up a variety of issues around how to screen for kidney disease in general practice, especially in people with diabetes. And we have pretty good screening tools to use now. And so this is one of the areas of focus that we have in the clinics at Toronto General, is to try to identify kidney disease early and treat it because of all of the new tools that are now available. So diabetes is the leading cause of kidney disease in Canada, and about 1/3 of Canadians living with diabetes for more than about 15 years develop kidney disease. In addition to kidney disease, patients have a variety of other complications in the setting of diabetes that are common and also quite serious, including heart disease causing heart attack or stroke, eye disease, which we've heard about already, as well as foot disease. So how do we manage people with diabetes? Well, there are many specialists who are typically involved in the management of people with diabetes. They often have to come see me or to see Catherine because of their kidney disease to manage their blood pressure and other issues. They also often need a diabetes specialist like Dr. Lewis to manage their blood sugar levels and their lipids and other issues that arise. And they often need a cardiologist to treat their cardiovascular complications. We thought it important to think about whether all these specialists could be in one clinic to manage all of these complications and to manage all of the underlying conditions such as blood pressure and blood sugar control. And so as a consequence, about 7 years ago, as a group, we started a clinic called the Cardiorenal Endocrine or CARE Clinic at University Health Network, which was designed to integrate and combine the care so that patients would have sort of a one-stop shop for all of these health-related issues related to their diabetes. So this is what the clinic essentially looks like. So that's a picture of me at the top, Jay Udell in the middle, who's the cardiologist, and Alana Wiseman on the right-hand side, who's the endocrinologist. And then you can see the various components around the patient, who is always at the center, including the ophthalmologist, the pharmacist, clinical fellows who have trained in the group over the last couple of years, a diabetes educator, chiropodist, and dietitian, all of which comes together to help our patient at the center and optimize care and as well as their experience in the clinic. So the Diabetes Kidney Disease Research Program has a variety of purposes. One is to transform the future of kidney care, to develop innovative diagnostics, to screen patients early, as well as identifying sometimes when patients present late, to improve their outcomes. Our major goals are to identify new factors that are linked with progression of kidney disease. And we've also participated in most of the exciting clinical trials that have been ongoing over the last few years that have identified new therapies to reduce heart and kidney risk. Philanthropy has also been critical to our success. So donations that we've received have funded fellows within the CARE Clinic program who have, as I mentioned, gone off to do work around the world to conduct research, care for patients, to develop their integrated care clinic practices, and to incorporate what they've learned into those practices to deliver this patient-centered model that I've told you about today. So in terms of takeaways, what I hope I've told you about today is that diabetic kidney disease is complex. It's a condition that requires many specialists and can increase the risk of both cardiovascular disease and of mortality. UHN is home to a unique care clinic that brings these specialists and our allied health colleagues together in one place. And this integrated care model, we hope, benefits our patients and also helps healthcare professionals to deliver better care. And implementing this model could really improve the care of patients with kidney disease and other complications, especially cardiovascular disease, for more patients as we expand and develop this clinic further.